Hello, everybody. I'm assuming everybody is just hopping into the meeting now. I was in the waiting room. Welcome.
Hi, everyone. Sorry, I was running a little behind schedule.
Hey, welcome. No problem. I think we all just got in to the meeting. Helen, I see your message. Please drive safely. Thanks for listening in. I give folks a minute. Our good afternoon, Anthony and Lloyd. Good. I apologize. I'm got some allergies or something going on today, so hopefully it's passing, but if I sound a little funny, that's what's going on for me.
Sorry, it seems like we had another meeting that was right before this, and so Keisha is coming in from that, and then we'll start working on getting a quorum set up. I'm sorry.
Yeah, no problem. And thanks for that update. I do know that we do not have voting items today because our minutes are not ready. But I would like to make sure we have a good amount of people here before we get updates from Sharita and then our presentation. So does look that we have a significant amount of people here, and I'm seeing a lot of names that I recognize. So I'm going to go ahead and call this meeting to order. Welcome, everyone. As a reminder, the sign-in form is just dropped in the chat, so please do that so we can count your attendance. Russ is coming in a little late as well, so I'm going to say we're calling this meeting to order at 3:06 for the record. At the top of every meeting, we read our goals. So I'm going to go ahead and do so. So our first goal is finish the job of ending chronic homelessness, prevent and end veterans homelessness, prevent and end homelessness for families, youth, and children, and set a path to ending all types of homelessness. A little bit of housekeeping. Again, check the chat for the form to sign in. Some reminders now that we're on a fully remote meeting this month. Stay muted unless you're coming off of mute to speak. If you've got a question, please raise your hand and we'll get to you. And then if you've got other questions, you can put them in the chat and that will be also monitored. Next is public comment. Did
No
we
one
have any
signed up for public comment?
Okay, great. Thank you so much. I'm glad you're here, Keisha. And is there anyone here today that would like to give a public comment? All right, hearing none, we'll move along. We again had so much fun in February during our retreat and our hybrid meeting that our minutes are not ready. So we will be voting on those next month. So we'll be skipping that item. And we'll be moving into our policy and planning quarterly report from Sharita.
Hello, everybody. While we've had a lot of robust conversations in policy and planning over the last quarter, most of those conversations have been around feedback around our winter shelter process for 2023-24, and we started planning for our winter shelter needs for 2020 for the coming winter. We've also had updates from our lead work group around the lived experience work that's being done by that team. I don't think that I'm missing anything else. Can anyone else on policy and planning think of anything I missed? In our last meeting, we did start early trying to come up with our winter sheltering plan, and also looking at maybe an opportunity to be able to stand up something like Heart stood up this past year, and whether we had the capacity in the system to do something like that. There was some questions near the end of our last meeting about whether we wanted to pull out and assemble a smaller work group around winter shelter planning for 2024, 2025. That will be spearheaded by Drew Wooten with Open Table Ministry, who currently has the winter shelter contract with the city at this time. If anybody is interested, as soon as we have the next date that group will be convening, we'll be more than happy to forward you that information about that meeting. And that is all.
Great. Any questions for Sharita or for policy and planning? I have yeah, Ricky, go ahead.
So for winter shelter, is there a particular funding stream that Durham has available to it that would cover the costs of making that something that we're able to do every year?
So
Oh yeah, I was gonna say I'm gonna defer to Colin.
the answer to that, Ricky, is kind of. We are currently using dedicated housing funds because we started all this white flag work under COVID, and we were using emergency shelter grant COVID money that was allocated to us during the COVID pandemic. We realized that after the pandemic and after the pandemic ESGCV money ended, we still had a larger number of people who were unsheltered in Durham than pre-pandemic. And the city agreed to fund ongoing white flag for the last 2 years using dedicated housing funds. And there is currently a contract in place with Open Table Ministry that takes that out to June of 2025. And granted, I know June isn't a winter weather month, but it's easier to do it on a fiscal year, so it kind of could be used for weather. And there is a fixed dollar amount associated with that. And as Sharita said, we're in the process of trying to figure out how can we serve the largest number of people possible in the most cost-effective manner, knowing that the motels are incredibly expensive and cause a lot of other unintended headaches that go with that, where people are calling and they want shelter. And at the time they call, the only thing that's available is Urban Ministries. And they're like, nope, I don't want that. I only want a motel room. So we're trying to move back and find ways to meet the variety of, trying to meet the need. And we're trying to tease out, there is a need to get people out of the cold. There are some people who do not want to come out of the cold unless it's to a private bedroom or a private home or a private space. And the question is, are we as a system able to accommodate everybody's wants and preferences? Or are we only able to meet the exigent needs, and people who don't care for or feel that the appropriate or what's available meets their want or preference, we might not be able to help them. And that's the piece that we're working through at this point. And it's trying to find what's that healthy balance of providing options for folks. And as you know, during cold weather, the primary goal is to keep people from freezing to death or other cold weather illnesses or injuries. Does that answer your question, Ricky?
Yeah, really appreciate that. And I think, that's a great question for this group here. Is it about giving people their desires and preferences? Or is it about, helping them, get out of a potentially dangerous situation for a temporary amount of time?
Mm-hmm. And that's the challenge.
Sharita.
I would add to that, Ricky and Colin, that, as Colin said, the hotels are a very expensive, like our most expensive option. And so, and what our trends tell us is that folks like the hotels, but what we also know is that if we put all our money in the pot of funding hotels, then we only serve a small subset of the population. And so I think the discussion that was happening in the policy and planning group was, how do we serve as many people as we can who have a need, and maybe not have so many hotel options available, or have them for specific categories of people. And so my hope is that the work group that Drew will be kind of guided and directed on our next plan for our next winter weather season, that they will tackle that for us. I think it's unfortunate that we can't give people their desires, but the reality is that we have limited funds. And so we have to kind of make the best use of those funds.
Mm-hmm.
Thanks for that update. Oh, go ahead, Colin.
I was just gonna say, it's also important to know that even with a couple $100,000 a year, the numbers of people experiencing unsheltered homelessness, even if you took over, let's say, old Northern High School's gym and put up cots for everybody who wanted to come in, there's no guarantee everybody would show up. If that was the only option and it was 5 degrees outside or minus 15 degrees, there will be some number of people who will choose to remain unsheltered. It's important for us to remember as a planning deliberative advocacy body, we can't force people to do things they don't want to do. And we may want something for people, and it may be for us, wow, of course, I'd rather be inside than outside during this. But there are people who will choose to remain unsheltered for a variety of reasons.
But I just added in the chat that staffing still becomes a challenge as well. And so, we really do need to look at that, like what model will work and help us serve as many people as we can, and the capacity for staff or folks to be trained or willing just to show up to be able to man whatever it is that we decide to do. Those are big issues as well.
Yes, Ricky.
Well, since staffing was raised, with the flexibility of dedicated housing funds, Colin, is that only for like the nuts and bolts, like the cots and blankets and stuff, or would that have allowances for paying for staff?
So the way the contract is set up, it basically follows ESG rules for shelter, where you could use the funds for everything from operational expenses, food and utilities and insurances and blankets and beds and staffing, security, whatever you needed, you could use it, but you still have the fixed amount of money. And, back of the envelope math, if you put a ton of money in motel rooms, you need fewer staff. If you have a very big congregate shelter and you want that congregate shelter to not put people out in the morning and people could stay there all day, well, now you're going to take a huge amount of money to staff a large congregate place with a minimum of 2 or 3 people, 24 hours a day, 7 days a week. And that staffing cost, even for 3-4 months, gets extremely high very quickly. I'll do some back of the envelope math, but it's very easy to run through funding to staff or pay for motels. And then when you factor in, if you need to bring in food, this is where we start talking about how do you leverage volunteers? How do you leverage, the faith-based community could perhaps bring food and prepared meals to a congregate site if there's not a warming kitchen. So there's a lot of ways to look at doing this. We're really trying to figure out what's the best way for us to meet and help the largest number of people in the most cost-effective manner possible, and trying to land on where is that sweet spot to meet those needs, knowing that we also have and you'll hear about this later in the presentation, but we've got folks who are exited from the medical system who a congregate shelter on a cot is not going to work for them. And then, so where do they go? And that's another piece of this puzzle that needs to be looked at, and whose responsibility is it for that group? So there's a lot of moving pieces, and there is no magic wand. There's no magic potion that's going to sort of say, oh, boom, here we go. This works for 100% of people. The challenges are great.
Thanks for this conversation. Just to wrap us up, if folks are interested in being a part of this work group, Sharita, they would contact Drew or you?
They can contact me if that's easier. And then I can just send all of the email addresses to Drew in the email. And I'm putting my email address in the chat.
Okay. And do members of this work group have to be a part of HSAC or COC?
No, there can be COC members.
Can it be?
Please, if any COC members are listening and you're on and you want to be able to contribute your ideas, your suggestions to how we can improve our winter shelter plan for the coming year, please participate.
And could it be folks outside of the COC? I'm thinking like local folks that may have some interest.
Absolutely.
Okay. So what may be helpful then is if not all of our COC members are here, sending some sort of message out with that information. And then if folks know other people outside of the COC that might be interested, please forward that along. Is that possible?
Madam Chair, can I ask Drew Wooten to step in, because I don't want to bombard him either. Can he speak for a moment?
Yeah, please.
Drew.
Hey everyone.
Hey, Drew.
Hi.
Hey, yeah, feel free to jump in. We've already hosted 2 listening sessions. I don't have any more currently on the schedule, but if folks reach out, I'm happy to plan one more and we can try to find a time that works for folks.
So
Okay.
Drew, do you want them to email you directly, or you want them to email me and then I send everybody your way?
Yeah, why don't you send it folks my way, Sharita? That sounds
All
good.
right, so my email is in the chat, folks. Send it to me and I will make sure Drew gets your information.
All right. Thanks, everybody.
I will share just on the staffing challenge. One of the pieces is when you're trying to staff for only nights where it's 35 and below with precipitation, or 32 and below without precipitation, it can be very difficult to find people with very short notice to be able to staff places overnight unless you have a big enough staff that you can flex people's schedules and have people say, all right, you're working overnight versus daytime for the next couple nights to meet this need. If it's, a small organization, you're trying to staff overnights and you're not equipped to doing that on a regular basis, it makes it hard to find people with very short notice to work overnights, because most people working part-time also have full-time day jobs, and working overnights can impact those day jobs. So that's why sometimes doing the staffing, regardless of weather, for a longer period of time, you ensure that you've got staff every night, regardless of the temperature, and you've got a location to go to. So it's balancing all these different demands and all these different challenges and trying to land on where is it that's that sweet spot? How do you make it work?
Absolutely. I'm really looking forward to an update from this work group, and I know it's in great hands with Drew, so look forward to it. All right. Well, we're going to move into our next item, which is the COC debriefing. And Colin is presenting this. It's information only.
Thank you, Madam Chair. Let me pull this up and see if I can share my screen. Okay, so I'm not able to see hands and stuff or stuff in the comments, so please interrupt me, Madam Chair, if need be. Thank you. So this is looking at our Continuum of Care NOFO, the collaborative application that we submitted in late 2023, October of 2023. And this is looking at our scores. How did we do? Areas that we didn't do well, and also kind of walking through how does HUD score us. So this document that we're going to go through today summarizes our scores in a couple different ways. The first we're going to look at is how does HUD score our Continuum of Care application in general. After we look at it on a big aggregate, we're going to break it down and look at some of the high priority questions. HUD does not tell us how we score on every single question. So if you look at the table that we look at first, you'll see a number. If you try and add up the numbers when we get to the scoring detail, it's not going to add up. And the reason it doesn't add up is because HUD only tells us, here are the things we want to see and really are high priorities to HUD. So if we pay attention to what HUD says, these are the priorities, the rest should fall in place. The last table we will look at is a table that will compare how did Durham do compared to the rest of the continuums of care across the nation that applied during the same time period. We have, as the COC lead agency, as the collaborative applicant, we have submitted a request to HUD to receive a full debrief on the scoring, which hopefully we'll be able to get, and that would give us additional information and more detail than what we're able to provide during this meeting. However, the information we have today is a really, really good starting point for showing where are we doing really well and what are the areas that we need to improve in. So we're going to start off, let's talk about how the COC application gets scored. And it's important for us to remember that the NOFO is not like most grants. Most grants, most other funding opportunities, you submit your proposal and whatever attachments they say, and whatever you send is what gets looked at. Well, we submit a narrative and a bunch of projects during the application process. That narrative talks about what are our plans? How are we going to help youth experiencing homelessness? How are we going to help those exiting foster care? How are we going to help people who are unsheltered? How are we going to help people reduce their length of time homeless? We can write an incredible narrative But HUD's also going to look at our point in time count that gets uploaded, our longitudinal system analysis, the system performance measures, and our housing inventory chart that are all submitted at a different time, but those outcomes and those data points all impact our score. So we could write the world's greatest narrative and tell the greatest story, but if that greatest story doesn't match the data that gets submitted, then we're not going to score well. And the data that comes in from the longitudinal system analysis, system performance measures, and the housing inventory chart is a collaborative approach. And this is sort of data that comes from emergency shelters, rapid rehousing providers, transitional housing providers, permanent supportive housing providers, street outreach. All of those data points factor in on some level to how do we score as an overall system. Questions so far? Okay. So we're going to look at this. I did want to sort of share how did we do compared 2022 versus 2023. And obviously you can see bottom line, we went from 68% to 75%. We did increase our score by 13.5 points this year, which I think is fantastic. We did better in section 1, and section 1 of the application is structure, participation, and how do we coordinate amongst a variety of providers. And a lot of that coordination is how are you weaving ESG money with COC money? How do you work with state? How do you work with public schools? How do you work with the nonprofit entities? How do you work with the justice system? How do you work with the healthcare system? And questions about those types of things fall into that. So we did increase our score there. We remained flat, for lack of a better term, on the homeless information HMIS implementation, our PIT count and system performance. Section 2 really relies very, very heavily on things like length of time people remain homeless, the rate people exit homelessness to permanent housing, things like that fall into section 2. Homeless management implementation, that HMIS implementation is really tied a lot to how many providers are using the HMIS that help people experiencing homelessness. 3A, coordination with housing and healthcare. You'll see we made a significant improvement on that with 0 out of 14 points in 2022 and 7 out of 14 points in 2023. A lot of this is still we're trying to better understand why we didn't do well. We did have written commitments. I did review some of those written commitments, and it could have just been the way they were written, and they may have been too vague or may not have specifically called out that these services are specifically targeted to this project or this population and guaranteeing spaces. There were some pieces of some of the supporting documents that seem to indicate that they're available if people qualify, rather than we're committing the resources if this project or a project is funded. So overall, 150 out of 200 points. Now we're going to look at, out of that section 1, the structure and participation questions. Obviously, we're doing really well on housing first, street outreach. You'll notice rapid rehousing beds. Rapid rehousing beds, we are not doing well because we're losing those every year on our point in time count, where this data is pulled, not on our point in time count, on our housing inventory count, which is conducted at the same time as our point in time count. I did a little bit of looking, and basically our rapid rehousing beds in 2022, there were 186 beds being used, and that included some COVID money. And that number dropped to about 92 beds in 2023 when this data was reported based on what I was seeing. So we're not going to score well when the numbers are going down in rapid rehousing beds that are used. And some of that is a factor of not enough affordable units. Some of that is not having households that are appropriate for rapid rehousing or wanting to enter that particular program. So we really do kind of need to look at how do we beef that up? Because, you know, if we pick up 9 points or even 5 points on that, that would be fantastic. Help us a lot. Doing increasing non-congregate shelter capacity. We've scored 1 out of 1 the last few years. If we move away from the white flag as set up, I would expect to see that number drop to a 0 out of 1. So if we lose some non-congregate capacity, we either need to figure out a way to pay for it and keep it going, or pick up points in rapid rehousing beds, for instance. We are doing very well with partnering with public health on infectious diseases. So we did score maximum points there. Did well with involvement of people with lived experience with the LEAD group, and are doing pretty well with the project review and ranking process in terms of our transparency. So overall, we did pretty well on section 1. Section 2, this is where we get hammered and lose a lot of points. As you can see, everything from 38% of the maximum points to 100%. And it's important for us to think about, where are we going to spend our time and our efforts? What are we going to focus on that's going to make the biggest impact in our overall score? So bed coverage rate in the HMIS, we get 2 out of 4 points. Some of that is due to VASH, the HUD VASH vouchers and emergency housing vouchers are not in the HMIS. So we get dinged for not everybody who does homelessness with vouchers or whatever, putting data into the HMIS. The LSA, that's an easy one. That's just making sure that we as the lead agency submit usable data by the deadline. So we are very cognizant about making sure we do that. Reduction in first-time homelessness. This is something that we've stayed flat at. And this is really looking at how many people in our data sets are showing up as homeless who have not showed up in the HMIS in the previous 2 years. And one of the things that we are finding is we are seeing a growing number of people each week calling entry point as first-time homeless. Probably an average of 3 to 5 people per week are calling entry point as first-time homeless in Durham. And entry point is trying to figure out how to absorb them into the system. Strategy to reduce length of time homeless. Clearly, we are seeing that number is, we lost points. That number is specifically looking at people in emergency shelter, transitional housing, what is the average length of time they have experienced homelessness before entering housing. In 2022, that average length of time was 116 days of being homeless. In 2023, that number had moved up to an average of 119 days of experiencing homelessness before exiting. So as you can see, going in the wrong direction of length of time being homeless does not help that score. There's other pieces to that, and we're digging into where it is, but on the whole, we've got to figure out how to get that 119 days going downward if we want to increase this score. And this is an area that, you know, even if we could get to 65% of 13 points, getting 6 or 7, 8 points would be a huge increase in our overall score. Strategy to increase exits to permanent housing destinations. This is another area where we're really, really struggling. And this is one where we're really looking at, HUD pulls the data from the HDX, from the Homeless Data Exchange, which houses our system performance measures. And when you're looking at that data, they're pulling that data from emergency shelter and transitional housing programs. And in 2022 and 2023, as a system, only 40% of people in emergency shelter and transitional housing are exiting to permanent housing. So 6 out of 10 people in emergency shelter and transitional housing are exiting to temporary housing or unsheltered housing or other locations, mental health, hospitals, jails, things like that. So 60% of folks are not exiting to permanent housing. So we've really got to work hard to figure out how do we increase that number if we want to try and attract additional bonus projects. And this is, again, another area that we really could spend some time sorting through. We have done really well. On the flip side, those who do exit to permanent housing, on the whole, a very, very small percentage of them are showing back up in the Durham homeless system within 2 years. So we do have people who exit shelter to homelessness, go back to shelter, go back to homelessness, go back to shelter, go back to homelessness. That does not count towards the returns to homelessness. The only returns to homelessness that count are people who exit homelessness to permanent housing and then within a 2-year time period, return to homelessness. Does that make sense? Cool. We're also struggling a little bit, not a huge number of points still available on this one, is increasing employment income. And looking at that income, when I was looking at the data sets, right now we're showing only 18% of the people in that data set were able to increase their employment income. 18%. So that's a pretty low percentage. I suspect that we could probably find a way to increase people's employment income pretty easy. If we were at like 98%, there's not a whole lot of room to move. But if only 18% are having employment income, I think we've got some room that we could work on to try and help people get connected to income or collect that data to make sure that it's entered to help give us some points on that as well.
Colin, can I interrupt?
Please.
So this is including PSH, Rapid Housing, like all COC funded programs.
On the employment income?
Yeah.
Yes. I have to go back and double check, but yes, it looked like it's all on adult leavers from the homeless system. Lloyd could probably go in and double check it. It's metric 4.4 on the HDX. But my notes are it includes sort of as an overall system, 18% are increasing our income.
I can chime in on that, Colin.
Please.
Measure 4 on the system performance measures, it's the only measure that specifically focuses on the performance of our COC funded permanent housing projects. So it's our COC funded rapid rehousing and permanent supportive housing projects. So it is a subset of the larger system of people experiencing homelessness or receiving assistance.
So it's just the COC rapid rehousing and the COC PSH. Thank you,
Correct.
Lloyd. And there were not many people exit, and it's really focused on the people who exit those programs during the year, from what I could see. Does that sound right, Lloyd?
No, I think it does also look at the people who are still in the projects.
Okay.
And whether they're also increasing income.
Okay. Yeah, I just jotted down, just the only note I jotted down was the 18% of those who left the program had increased their income. So we can share more data on that if you'd like.
There's a couple other questions in the chat. One from Sally, one from Victoria.
Is it an option for community development to manage the beds in HMIS on behalf of DHA? in order to manage the beds in the HMIS, the amount of data we would need a dedicated staff person to do that, essentially, to manage the EHVs, VASH vouchers, and others in there, because that is entering them into the project, then needing to go out and do all the annual certifications and renewals, and all of that piece has to be done annually. And that's hundreds of people. So at this point, community development doesn't have staff capacity to do that. The VA doesn't have access to the HMIS, and that's a VA legal decision. Not that, and I want to be clear, Nicole Wilson and the VA would be happy to help us out with that on the VASH side. However, there was a decision made way above most people's pay grades, where VA said that was not going to be an option. And DHA is doing the best they can with trying to help us, and have helped us with the VASH vouchers in the past. And we're hoping they will come back and continue to do that, because DHA is the one who's issuing those VASH vouchers and has the data and doing that certification. It just means they have to do the data entry in another database besides their own. Victoria, are people being screened and referred to supportive employment as part of? That is a question that would have to be asked and answered by the various PSH and rapid rehousing providers as to how people are being reviewed and supported to try and increase income, earned income. But we hope that they are, yes, we would hope so. And that's part of why we're bringing this up, is to flag it and do some digging and see if whether or not people are doing it. I will say HUD is notorious for talking out of both sides of their mouth. HUD will tell you, we want people to increase their non-earned income through disability income and SNAP and mainstream benefits. But we also want you to increase your income through earned income. Well, you can't necessarily do both, because if your earned income goes up too much, your mainstream benefits get reduced. So this is a place where HUD kind of wants you to do two things that are mutually exclusive. And we have to try and figure out, how do we weave these two together and try and ensure that clients remain housed as best as possible while trying to do two mutually exclusive items.
Colin, I will just add, I think that there was a question on the Housing First assessment that we are completing or finishing up around employment. So there might be more data that's available soon on that piece.
Yes, we are working on and we scored very well on, and that'll come up in a little bit, but we did score very, very well on our Housing First evaluations, and we did score maximum points on, as a system, using a Housing First methodology and evaluating those projects. Commissioner Carter, using housing choice vouchers, DHA makes referrals from COC. Maybe we'd have to figure out how many units that is. DHA makes up to 225 vouchers available, and not annually, but available if they are available. Right now, we're not using all 225 because 225 are not available. And right now we are trying to get the last of our emergency housing vouchers leased up. We would essentially community development would have to move into a service provider role to manage that and be working directly with clients, which would be something above my pay grade to make a decision as to whether or not the city and community development wanted to move into a direct service provision role of working with clients to help pull together that data. So that's the piece that we would have to navigate. Other questions on section 2? Our narrative on all of this is very, very good. We just struggle with the data, and that data is stuff that we cannot control. The data is the data. That's what gets pulled out of the homeless management information system reports. This is the data that's entered by all of our service providers based on what's actually happening in their projects. Now, this is our coordination with housing and healthcare. We talked about that a little bit at the beginning. We did move to 7 out of 14, which is definitely a huge step in the right direction. And we're hoping to try and get more clarification on what triggered that issue, like why we couldn't do better, because we thought we had a pretty good letters from Duke School of Nursing and Alliance and Project Access, and thought we had pulled together dollar amounts and what would be provided. So we are hoping to get better clarification on what we can do to improve that. One of the areas that, we are running into a challenge with is exits from the healthcare system for folks who are, medically fragile, can't meet their daily living skills and are able to care for themselves and have no money to go to an assisted living or family care home. They may not be appropriate for emergency shelter, so they end up being exited to unsheltered homelessness. And that's the piece that we've got a big gap in the system. And I'm going to say big gap. I don't really know the size of the gap because we don't know exactly how many people fit that description being exited annually. We are finding a handful here and there. So we are trying to figure out what is that and what do those folks need to be successful and hopefully not be unsheltered. So the highest score for, sorry, this was Durham's highest score. Let me make sure I got the right piece in here. So I may have. The highest score, so this shouldn't be 22, 23. The highest score for 23 was highest score in 2022 was 188.75. The highest score in this from any COC across the country was 185.5. Then the lowest score for any COC in the country was 53.3 or 53.5 and 54.5. The median was 154.5 and the median in 2023 was 151. So Durham's score in 2022, 136.5 and 150 this year. This year we hit 99% of the median. So we're right about the middle of the road for COCs across the country. Now, if you look at us in terms of how did we do in relation to the highest, 81%. Lloyd and I were talking, and if we could pull another 15 points, we would probably get some bonus projects. But we've got to figure out how to increase that 150 and not lose points on other pieces by, get us up into that 90% range where we're able to really score well and be able to attract some bonus projects for PSH or DV rapid rehousing. So just to recap, areas of strength, our housing first, lowering barriers to entry. Street outreach is doing great. The non-congregate shelter was doing great, but we will probably lose that point in a go forward if we don't do motels or have some other non-congregate shelter option available, unless we get creative on how we classify things. Partnerships with public health to prevent and prevent the spread of infectious diseases, we do well. Advancing racial equity, doing our assessment on that, we've done very well. As you know, Jeff has pointed out numerous times, we're operating at equity in terms of balancing people coming in and exiting to positive locations. amongst racial groups. Involving individuals with lived experience is doing great. We're doing a good job on the review and ranking. Our LSAs are good, and we're reducing our rate of returns to homelessness. So this is the areas to go back to. What do we want to look at? These are the 4 items: rapid rehousing, length of time homeless, exits to permanent housing, and coordination with housing and healthcare. Those are the areas that we really need to try and figure out what to do, how to do it. And the key takeaways are we've got a great structure, and we are continuing to work on our housing and healthcare piece and opportunities to improve the COC score. So with that, I think I don't have anything else to go over. Questions?
Ricky, I see your hand.
Thank you, Madam Chair. And this one's not directed at you, Colin. Like, this is really for anyone on the call who might have information, but just thinking about, that what the through line is between, housing and healthcare, and wondering how Medicaid expansion might be able to help our efforts in making sure that those medically vulnerable folks aren't, released from hospitals to the street. Because I think the expansion might include, and do not quote me on this, like I hate being recorded right now because I feel like this is super wrong. But like expansion might include money for rental assistance. And like, what could that look like? I don't know.
Thanks, Ricky. What I can say is that in exec, we've talked about having a presentation for full HSAC around Medicaid expansion transformation from potentially Ann Oshel or Fred Johnson or both. So I think that there are definitely opportunities to learn and talk about that further. And I imagine that will be on our agenda in our next exec meeting to talk further about scheduling that. But the way I understand it is the way you said it, is that there are some opportunities in Medicaid expansion to support rental costs for certain populations. Sharita, did you want to add something?
Not at this time.
Okay. Any other questions for Colin or for the group? All right. Thanks, Colin, for that update. And I assume that if y'all are able to get that more whittled down information, that we'll get some more updates in the future. Great. Thank you. Moving on in our agenda. Next we have COC listserv requests. This is information only, and I'll pass it over to Keisha.
Afternoon, everyone. Keisha Barnett, the new Homeless Service Systems Management Coordinator, assisting with the COC administration, replacing Melissa, who is still with us, but she's been promoted to an analyst position within our office. And I want to share some information about our COC membership and updates on the COC listserv that we're planning going forward. We are in the process of planning our annual membership renewals to include a new membership orientation and also updating our listserv. And that's where we share information about the COC and the things that affect our system. You don't have to be a member of the COC to be included on the listserv. I just want to make sure that everyone knows that. However, if you're interested in joining the COC or need to renew your membership, we would like to encourage you to fill out the form in the chat for, hold on a second. complete the form in the chat so we can make sure we get your information, which is just your name, your email, and your agency, organization affiliation. And please make sure we have that information so we don't leave anyone out, and look forward the information on the CLC membership renewals that is coming out shortly. And that's all I have.
Awesome. Thanks so much. And I forgot that folks may not have met you because I got to meet you in February. So thank you for introducing yourself again. Super pleased to have you with us. And it was wonderful meeting you in February. And hopefully those that have not had a chance to meet Keisha yet will get to do that soon. Any questions for Keisha before we move on? All right. So we made it to the end of our agenda. This is the time for announcements. So anybody that has an announcement can raise their hand or drop it in the chat, and we'll offer you a little time. Yes, Colin.
Thank you. I did want to flag that Lloyd Schmeidler will be retiring and leaving the city of Durham at the end of April. So we will be having a little gathering and drop in on April 15th. So we will send out details for that, but wanted to make sure April 17th. April 17th, we were going to do a drop in to say goodbye to Lloyd, and for anybody who would like to come by. And we'll send out details as we get that sorted out. So put it on your calendar.
Great. Thanks for letting us know. And does that mean that Lloyd will be at the April meeting, or this is Lloyd's last meeting with us?
I will let Lloyd speak for himself.
I will be attending the April 24th meeting. I believe I may be scheduled to make a presentation actually so thanks for the congratulations, everyone. It's been a great ride, and looking forward to continuing to be involved in efforts to address the needs of our community in the coming years. Ending full-time employment, but probably there'll be some part-time and volunteer things that may give me opportunities to continue to interact with many of the wonderful people on this call.
Yeah, we'll miss you, but we're excited for you. And I'll let folks embarrass you more with their congratulations the next week. She'll be here and offer their gratitude. But in the meantime, we'll look for that invitation. Thanks, Colin. And anyone that's able to make it or would like to send words of appreciation via email, please do so. Any other announcements? Yes, Lloyd, please go ahead.
Thank you. I'll, on a business note, I'll share one announcement. The HMIS at NCCH Advisory Board had its every other month meeting on Monday, and one of the issues that the board is going to be looking at is the issue of whether we should change HMIS software. There's been concerns for several years about our current software, which is owned by a company called WellSky, and there are several private companies that do offer software for HMIS implementations around the country. I think there's 4 or 5 or 6. Obviously, they all have to meet HUD's requirements for what the functionality that an HMIS needs to have. And we'll be consulting with the executive committee at its next meeting, I believe, as to how we want to have the Durham COC involved in making that decision. to change software. In my view, it's a very important and major decision because it really impacts the way that the HMIS users who use the system on a daily basis to track their client services and the clients they're serving in the system interact. So it's a pretty major decision to change the software. But so I wanted to bring that to your attention. Thanks to everyone for your goodwill messages and congratulations in the chat. I do appreciate it. Thanks very much. I'm going to stop looking at the chat now. Thanks.
All right. Last time for announcements. Thanks, Victoria, for sharing that in the chat. All right, seeing none, no other announcements, please remember to look at the end of your agenda for some reminders. Our next HSAC meeting, policy and planning meetings, executive committee meeting, performance management committee meeting. If you're interested in attending any of those, a reminder that we have an open seat. And yes, that's the last one. So now reaching the end of our agenda, I will take a motion to adjourn.
I move, Sharita.
Thanks, Sharita. A second from Helen. It's 4:04. Thank you. Great to see you all, and we'll see you next month.